Cookeville Regional Medical Center, the Upper Cumberland's proven choice for healthcare. Here's Jill Bowling.
When faced with a surgery, most people have questions, concerns, and they may even be a little curious about what their surgery experience will be like. Today, many patients are pleased to find out that many surgical procedures are often same-day outpatient procedures. At Cookeville Regional, the surgery program ranges from the simple to the complex. So join us this month as we take an in-depth look at the general surgery program at Cookeville Regional.
At least 80% of the work I do is outpatient surgery, and people just come in and go home the same day. Back 150 years ago or so, when the mass of medical knowledge was much smaller than it is now, there was really just one type of surgeon that did everything. That person was the general surgeon. Then as medical knowledge increased, then you began to see certain skill sets were needed to perform certain things. Nobody can do all that well. The portion of that original block of knowledge that has kind of remained throughout the whole period of time is now called general surgery. Well, I've been doing surgery here in this facility for 31 years. The biggest changes that have occurred have been within the arena of breast cancer, and that's primarily because of mammography. When I first came into practice, the average patient that I saw with breast cancer probably had about a 40% chance of surviving the disease. And now the average patient I see has at least a 90 to 95% chance of surviving the disease.
The surgery department sees over 6,000 patients throughout the year. To keep the surgery schedule running smoothly takes the coordination of dozens of people. Meet the surgery department's director, David Phillips.
Well, it takes everybody, all the nurses, all the surgical technicians, our patient care techs, all the physicians working together as a team. There's an infrastructure that I put in place that helps us operate efficiently on a daily basis. We recently picked up an efficiency award with some national recognition on how we do our business every day and how we keep our patients safe. Presently, we have 10 operating rooms, or as they're known as operating theaters. Each one is unique to a specific surgical service line. We can pretty much do anything that is done in Knoxville or Nashville, right here in Middle Tennessee at Cookeville.
Offering our patients the latest advances in surgery, as well as providing optimum safety and ultimate satisfaction, are always at the very top of our priority list.
Well, anybody who's going to have surgery, even a layperson, or it could be a nurse or a physician, there's going to be some anxiety.
It's understandable to have some fear going into surgery. I've had surgery before and fully understand it, and that's normal. It's something we do here daily. We take a lot of pride in performing the best possible surgery that we can. It's not something we take lightly, and we strive daily to improve. And here at Cookeville Regional Medical Center, we've won numerous awards in general surgery about the quality of the surgery and the outcomes. So.
First of all, it was an emergency situation. I had to go to the emergency room. They quickly got me in the back, got me taken care of. Almost before I could blink, I was in surgery and had the appendix out. I was up the same day as the surgery, and I was back to work within 2 days. With the professionalism of everybody at the hospital, it was a very smooth experience.
Don't put it off out of fear or concern and let it get worse.
The one thing that I could press upon our patients when they come here is that we routinely drill and are prepared for emergencies. That we have adequate, very competent, skilled staff that are here that are continuously trained, and they're going to receive the best care here in the state of Tennessee.
For patients recovering from surgery, there is a new, beautiful, spacious surgical unit in the North Tower. Take a look as we tour the unit with Nurse Director Mary Alexander.
5 North, it's a 32-bed, all-private room unit, mostly orthopedic, general surgery, urology, GYN procedures. We have a small percentage of pediatrics. This is one of our family respite areas that we really tried to focus on accommodating our families just to get out of the rooms for a little while. This is an individual nurse workstation where she can document, do her documentation for each patient she's assigned to, and it cuts down on the medication errors by like 99.9%. This is one of the private rooms of the 32 that we have, very spacious. We have the couch that pulls out for family members to stay the night. We encourage people to stay and assist with the care of their family member if they would like. We also have designed the very spacious bathrooms that meet the safety standards and easy to get in and out of the shower. We're also very pleased to say that we focus very much on quality care, and with that said, we decrease the ratios for the patients on this floor to have 4 patients per nurse on days, up to 5 sometimes, and then 5 to 1 on nights, makes it even more of a conducive environment for making sure the patients are taken care of efficiently.
There are 7 general surgeons on staff at Cookeville Regional, and they can handle the basic to the most intricate of surgeries. Dr. Jeff Moore explains.
We do a wide array of different types of surgery. We operate on the neck and the thyroid and the parathyroids. Do a large amount of surgery on the breast in regards to breast cancer. Do abdominal surgeries, hernias, do surgery on the peripheral vascular system, and just wear many hats. I mean, it's a complex field and becoming more and more complex every year. We do many minimally invasive surgeries here. The whole general surgery and most all surgical specialties are moving towards minimally invasive. There's less postoperative pain. Patients tend to do better in the postoperative period with minimally invasive surgery. And after the surgery is complete, I like to go talk to the family and let them know how things went and reassure them, because it's you know, they have a lot of fears as well out there, and they wait patiently for me to come out and talk to them. I think the public here in the Upper Cumberland region and in Putnam County and Cookeville are very lucky to have the number of quality surgeons we have here at Cookeville Regional. Anesthesiologists, the nursing staff is very, very experienced. We stay very up to date and have an excellent group of surgeons in this region. And I think we're lucky. There is a national shortage of surgeons, and I think we're again, just lucky to have the number we have here.
The most recent addition to the surgical team is Dr. Kevin Purgel. He explains what drew him to Cookeville Regional.
Number one, the people. People have been very friendly. It's a very small town, which is what I was looking for. Number two, the size of the hospital. The hospital is a very large hospital in this area. It's a regional hospital, so it serves many different counties, which is also appealing to me because of my specialty. So number three, it would be the technology here. Comparison to the other areas around or the other hospitals around, this is very advanced. Most of what I do is laparoscopic, so it's small cameras, small incisions. My purpose, I guess, as being a general surgeon, is that I feel that every time we take somebody to surgery, or I take somebody to surgery, they're putting their life in my hands. It's very important to make sure that they see me as somebody that they can trust. Somebody that I've answered their questions, I've sat down with them, somebody that they can see as taking an interest in them and have entrusted them with me. I'm always available. Also during surgery, I'm obviously there during the entire case, but then after surgery, I'm there when they wake up, and I'm also out talking to their family, showing them pictures a lot of times that those great HD optics have been able to let us do, and make sure that they're aware of what went on. Also afterwards, when they're gone home, to just be available until they are seen in the office.